Hey, what's up guys? Welcome back to Dr. Says. In today's video, I'll tell you how to know if you have osteoarthritis all by yourself at home without seeing a doctor. Now let's get on to it. Well, if you really want to know how to do it, first you must be able to spend 10 years of your life studying and going through sleepless nights, no weekends, no parties, sitting exams almost every week till you finally become a doctor. Well, luckily for you, because I love you guys so much, I've done all of that for you in this channel, and today I'm going to teach you how to be your own doctor in less than 5 minutes or so. Like most of the medical terms, osteoarthritis is derived from the Greek word osteo means bone, arth means joint, and itis means inflammation. So simple, inflammation of the joint. Once deemed as a misnomer as thought it was more of a wear and tear process and degeneration, recent research has found that inflammation does actually play a role in OA, and hence itis, which is indicative of inflammation, is indeed correct. Like all good doctors, we diagnose a condition by asking lots and lots of questions. First, how old are you? OA is clearly related to aging. Aging affects the cartilage. What's a cartilage? If you ever come across a white shiny thing when you're eating chicken wings, that's a cartilage, and you have that in your knee. Aging causes thinning, calcification, and brittleness of this cartilage. As you age, the cells in your body are slower to repair this damage, hence leading to inflammation of the joint and ultimately destruction of the joint. Second, are you a male or female? Because OA is more common in women, especially postmenopausal women, and it is said that loss of estrogen could be the contributing factor. Third question, do you have any severe injury to your knee before? In medical terms, it is known as post-traumatic OA. OA can develop after injuries that result in ligament or meniscal tears, or after injuries such as fractures that involve the joint. The idea is the same. Injury causes inflammation, and inflammation causes destruction. Fourth, how heavy are you? Body weight is a risk factor because the knee joint is a weight-bearing joint. The heavier you are, the more stress you put on your knee joint, the faster your joint wears out. Oh no! Fifth, what do you work as? Does your work require you to stand for long hours, putting more pressure on your joint? Or are you an athlete, which are prone to knee injuries? Finally, do you have a family member with OA? Because believe it or not, genetics does play a significant role, and the risk of you developing OA is higher if your parents or grandparents have osteoarthritis. Now, let's move on to the signs and symptoms. The main complaint of OA is pain. The pain is typically worsened with joint usage, example standing, walking, running, and it is relieved by rest. There are 3 stages to it. Stage 1. A predictable sharp pain, usually brought on by a mechanical insult that eventually limits high-impact activities like running, jumping, with a relatively modest effect on function. Stage 2. The pain becomes more constant and starts to affect daily activities. There may be unpredictable episodes of stiffness. Stage 3. Constant, dull aching pain interrupted with episodes of often unpredictable, intense, exhausting pain that results in severe limitations in function. OA pain is generally worse in the late afternoon or early evening, but can also be worse in the morning soon after waking up. There may be also night pain in severe OA that can interfere with sleep. If severe, one may have the feeling of giving way or buckling of the knee. One may easily stumble or fall and have the feeling of instability of the knee joint, making tasks like climbing a stairs difficult. A simple test you all can do now at home is in a sitting position. Just place your palm gently on top of your knee. Now gently raise your lower leg till your knee joint is fully extended. Do you feel any crackling sound running through your palms? This is medically known as crepitus. It is caused by the damaged cartilage floating around your knee joint. Other signs doctors commonly look for are tenderness over the joint line or bogginess surrounding the knee joint, which may suggest synovial fluid accumulation and inflammation. Other signs include bony swelling and joint deformity in the later stages. Frankly speaking, you do not need an X-ray to diagnose osteoarthritis. With proper history and examination, one can confidently diagnose OA. Doctors use X-rays to supplement our findings and to monitor the progression of OA with time. So there you have it guys, these are the most common signs and symptoms doctors use to diagnose osteoarthritis. Leave a comment down below if any of you experience these symptoms. And don't forget to smash the like button, share and subscribe.